Hello everyone, welcome back to Neurospicy Nursing. Today's lecture is going to be a part one of the different complications of pregnancy. I know you guys are like, oh my God, girl, you've put out like 3 videos today. What are you doing? Um, since you guys are locking back in for summer semester, I need to lock back in with you guys. I know it was a little bit hectic last semester since it was my last semester of nursing school, and then I was gone for a bit and studying for the NCLEX, which I took recently. Haven't gotten my quick results back, but I'm waiting on those. Um, but yeah, so this is complications of pregnancy. We're going to go over it today. Specifically, what we're going over today is hypertension in pregnancy and breaking it down into the 4 clinical significant subsets that are part of hypertension in pregnancy. So the first one is gestational hypertension. It's going to begin after 20 weeks of gestation, and it's when you are presenting with an elevated BP that is greater than or equal to 140 over 90 mmHg on 2 occasions at least 4 hours apart within the same week. Another thing to note here is that they're not going to have proteinuria, and after giving birth, their BP is going to return to their baseline by at least 6 weeks postpartum. Next is preeclampsia. So there's mild and severe preeclampsia. Mild is basically everything is the same as gestational hypertension, which is shortened as GH, but they have an addition of 1 to 2 plus proteinuria. And then there's severe preeclampsia, which you will have a BP of greater than or equal to 160 over 110 mmHg on 2 separate occasions at least 6 hours apart. You have proteinuria of 3 plus, oliguria, a creatine level of greater than 1.1. They will also have visual disturbances. I'm so sorry if you guys can hear my dog scratching on my bed. Hyperreflexia. They can also have pulmonary and cardiac involvement, extensive peripheral edema, hepatic dysfunction, like elevated liver tests, liver function tests specifically, epigastric and right upper quadrant pain, and thrombocytopenia. Next is eclampsia, which is basically severe preeclampsia, but they have seizure activity at this point. It's going to be preceded by a persistent headache, blurred vision, right upper quadrant pain, or altered mental status. Um, the other thing to note here is that I will be posting a lecture on magnesium sulfate and everything that you need to know about mag sulfate. Probably won't be today, probably will end up being tomorrow because I've already put out 3 today. But everything that you're going to need to know for your test about mag and what's important for it. Okay, we're going to go full in depth and what is mag used to treat in pregnancy. Okay, and then the last one is going to be HELLP syndrome. So, HELLP syndrome, remember, it's still going to be a variant of GH, but in this case, you have a hematologic condition that's coexisting with severe preeclampsia, so there's no seizure activity, okay? That's the difference between eclampsia and preeclampsia, is the seizure activity. So it's hematologic conditions that are coexisting with severe preeclampsia, and at this point, it's going to start involving hepatic dysfunction. HELLP syndrome itself is going to be diagnosed with laboratory tests. It's not just you look at them and you can tell that they have HELLP syndrome. You know what I mean? So H stands for hemolysis, resulting in anemia and jaundice. EL stands for elevated liver enzymes, which result in obviously an elevated ALT, AST. They can also end up with nausea, vomiting, and epigastric pain. LP stands for low platelets, so you'll see thrombocytopenia, abnormal bleeding and clotting times. They also could have bleeding gums, petechiae, and possibly DIC. DIC is another thing that we're going to go full deep dive in. I mentioned it in the previous lecture. We're doing a full deep dive into DIC as its own micro mini lecture, okay? But that's everything for this one. Here are all those resources, all my templates. They're from Canva. And thank you guys. I'm gonna be including this little thing from now on because I think it's so cute and it's me cheering you guys on. Okay, that's it for this lecture. Thank you guys so much, and I will see you in the next one. Bye.